Hello everybody, my name is Jenny Sprung. Welcome to treatyourselfnaturally.com. This is a do-it-yourself video production by me, and so I have to turn it on and turn it off and run back and forth, but here I am, and I would like you to join me today to work our quads, the front of the top of our legs. The quads are strong, powerful. They can place the pelvis in flexion. They can create all sorts of low back pain, hip pain, pelvic pain, glute pain, abdominal pain. Anytime you work the quads, you're going to want some equipment. All of this equipment is on my website, listed on the resources. There's also an article that goes along with this video. I just discuss a little bit of anatomy, some of the referral points, some of the jobs of the muscles, and that kind of stuff. So what you're going to want is a foam roller. Where to find these is on my website, about 30 bucks from a sporting goods store. However, you probably have one somewhere. Put away with all your exercise equipment. Go get it. That's for sure. You want that. This is triggerpoint.com. Rollers, these are excellent for low leg, forearm, hands, and feet. However, if you have a large roller at home, you can modify it yourself. And remember, you're in charge of everything. You are empowered. You have innate wisdom. If you tune into your body, you can affect change. So find a good therapist, a good neurosomatic massage therapist, a good alternative practitioner. Find a duo or a triage of your healers, well-educated, efficient, effective, qualified therapists. But in between, you can create change in your body. You can create space. You can free up the quads, the knee. If you have problems with your knees, all of the quads are in play and they need to be softened. If you've had surgery on your knee, get approval from your surgeon, your physician. Talk to your doctor first, always. Talk to yourself. And then work the quads. It will free up the attachments in the knee. So we'll look at these a little bit later. These are TheraBand, and they're kind of fun to work with. If you can't do the foam roller, you can work the fascia. You can warm the fascia up on your quads. IT band, iliotibial band. What I found though is folks overdo the foam roller on their quads, and they just do it too long and too hard. So we're working therapeutically. We're going to take our time, breathe in, exhale twice as long as the inhale, and go into fascia, stretching it, moving it, creating change in the fascia, and then rolling out the trigger points. And the trigger points, healthy trigger points release in 8 to 12 seconds with 2 or 3 big breaths. And the practice should be you come back out if it's feeling unhealthy, if it's feeling really sore, really tight, really tender, and then go back into it. So these are all great for folks who can't use the roller. You can find those on my website, the source for that. There are some other tools that we'll use for specifics. My T-bars, you can go on site and find links to those. These are not too expensive. You probably have some tools at home. This is just a stone that is for sale. The link is on my site. This is I don't even remember where I got this. This is a massage tool, best for hands and feet, and I have a bunch of videos on my website for self-treatment of pain in many areas of the body. So please visit and tell me what you think on my contact page. But we'll use these in the end to show you some specifics in case you don't have the foam roller. Most of you can find a stone This is a stone that's like a thumb, big thumb, but it's great. You can also go in right into the areas all through the quadriceps, laterally and medially. Okay? So these are some of the tools you need, and then also you've got to find a basket of balls. Find a tennis ball. They're super. Have a tennis ball and a basket of balls. Here's a racket ball. Here's a dryer ball. They're soft and they can be used. They have little points on them, but they're not too pointy. And you'll know, you'll be able to tell if the ball works for you or not. This is another TheraBand ball. This is actually excellent for the foot, but we can use it in the quad attachments and down the leg. So I'll show you those and the tools at the end. For now though, please grab your foam roller and place it perpendicular on your mat. You're going to want to work on a rod mat. You can work on a tile floor. That's fine. The quads require big breath, big muscles, super muscles, fantastic muscles. I would like you to start first on your side. So you're going to, for those of you who have sore shoulders, you're not going to want to do this. You'll start face down, and I can show you that now so you can hang out there and work while we do the side body. So shoulder plank here, both arms would be down, and that's a little easier. If you feel that this is more comfortable, just don't hang, don't compress the low back. All right, so side plank right up at the top of the iliotibial band, and this is intense. Now there's several ways to do this. Nice open shoulders, strong abs, relax the head. You can hold the head here if you'd like. The top leg is bent and in front, but you can also bend it and go back. And this would be cross the fiber, where you're going to roll face down and roll face up. Okay? I want to show you on the model where we are so you can know. There's another video about the hip and low back and glutes, so you can combine the two. I'm going to be right here. This is the greater trochanter, the acetabulum. I want you to go right in through here and then all the way face down and all the way face up. Okay? Gonna roll back and forth. And then we'll go down until just before the knee. Okay? Here are a ton of trigger points. They're just insane. They really are. If you sit a lot, you need to do this. You need to soften, create space in your quads. I'm going to go down the IT band, and with the legs are long levers, so you're going to need to come off and take a break. When you come into the greater trochanter, it's going to feel super sore. There's two things you can do to change it. You can relax that low leg, or you can make it tight, taut, and flexed. See which one works for you. Make your own decisions. Empower yourself to make those decisions on what works. If you find a place that's too much, relax the leg, come out of it, go around it, in front of it a little bit, and behind it a little bit. If you work late at night and have a night shift, and your low back hurts you, your hips hurt you, you should be doing this almost every day. How long? I think the video probably will be about 12 minutes, maybe a little longer. So again, good form, relax, go down a little bit more. I'm heading into the middle of the outside of the thigh. Okay. I'm going back into the hamstrings a little bit, the back of the leg, and then right into the front. This is all IT band. When you find a spot that's intense, you'll feel it right down to the bone. All of these muscles attach into the bone. They're just not flopping around. They attach all the way down the length of the femur, the thigh, and then all the way towards the knee with the fibers. And for some of you, this is going to be too intense. So you're going to want to lean and practice that breath. Tune into your body. Turn on some of your favorite music. Relax a little bit. And focus on your quad. Going down right above the knee to where the IT band attaches. You can do this with the leg bent, and that might actually afford a little bit more relaxation. You can come up a bit and roll out the entire side of the leg. Take as much time as you need. Don't overdo it though. Do it a little bit, then come out of it. Take a break. This affects such change, such space, blood flow. You'll get warm. You'll get warm and maybe even a little sweaty doing this. This is superb, and you can work on this a few more minutes. I'm going to move on to the face down quad work. You'll start all the way up at the pubis, at the pelvis. So you're not going into the tummy. You're not going into the hips. If you want to explore there, that's your choice. See what you feel. You can kind of roll a little bit and get the attachments into the anterior, inferior iliac spine. And let me show you on the model very quickly so some of you can see the actual placement. So I'm all the way up here, and that feels good. And there is a quad attachment up there. There's an article that's associated with this video that'll show you just a little bit of anatomy. This is not an anatomy lesson. This is about you reducing pain and discomfort, distortions in the body that create pain. You'll have a better posture. You'll have better gait. Your body will be energetically and structurally aligned and balanced if you work these large muscles. Okay, so again here, and then all the way down the leg, and then in here as well. Okay, so let's come back. A couple of leg positions I'd like to review with you. First of all, again, don't compress the low back and drop on the shoulders. Use your abs, be in a nice plank, relax your head, and roll back and forth on your quads. Now turn your feet out. Okay. So your feet are pointing out to the sides. And you'll be getting the inside of the quads. And then come off. I'm going to, for purposes of the video, just make sure that you can see. Again, coming down, and here you can get a little bit more of the inner thigh by turning one leg out. So my right leg is turned and bent. My left leg is straight but relaxed. I'm going to switch. Right leg straight, relaxed. Left leg turned. And then I get right inside that knee. And here, I have an old injury. And it just goes to show me, it's evident to me that I need to always roll out my left leg the rest of my life because of an old soccer injury in '82. And it's helpful. It creates blood flow, creates space. It lets my quad know, that I am paying attention. I'm listening. It needs some therapy. When you go and get professional work done on these muscles, you can amplify, you can supplement that work by checking in at home. You can do a lot of things at home by yourself, do it yourself. So now, coming back into plank, and you may find that you get tired on your elbows, and so take a break and come back to it. Do a little bit. You don't have to do the whole video. Now my toes are pointed in, pigeon-toed, and I'm going all the way up. And notice now, if I'm in good physical condition, I can use my upper body. I find a spot. I'm going to roll side to side. I'm going to find another spot, relax. exhale longer than inhale creates relaxation in the mind and in the body. 2 to 4 counts on an inhale. Whooshing sound, twice as long on the exhale. I'll show you the other IT band. Again, I'm going to bridge up. See, my arms are getting tired now. So if your arms are getting tired, take a break. Have a sip of water. Turn on another song. Like Bob Dylan. Like a Rolling Stone. And see, this is intense for me. If it's intense, you're going to need to brace and breathe and relax into it. If it's too much, you'll know it. Come out of it and go above it and roll. Or go below and roll it out. I feel this all the way down into my left knee. You can also bend the leg and roll the leg with it bent. Just be careful. Make sure you're not going to have that roller shoot out from underneath you. Now I'm going to show you this facing the other way. Okay. So the top leg is like a table leg. It's your balance. Your hand is your balance. And that bottom leg, I'm bending. I'm getting the whole thing. There's a lot of great resources on YouTube already about rolling out your quads. There's more advanced videos coming up from my website. This is just a beginner for you to pull it out and affect change in your body, change in your pelvis, create space for your knees, and help your low back. Okay, so we're going to put this large roller away, and I'm going to show you the trigger point roller. This is pretty intense. The triggerpoint.com roller is intense, so you're going to lay that leg on there. And my right leg, the leg I'm not working, is bent, and I'm again in my plank position. When I come up into the rectus femoris, the large muscle in the very front of the quad, I need to roll all the way to the very top of the knee. And that's really intense. But try these as well. These are superb for low leg, forearm, hands, and feet, which are in another video. I've got lots of pain relief options and self-healing options for many different parts of the body with associated articles as well on my website. So these are great for many different parts of the body. So now, if you have a spot on your quad that's sore, first of all, I'd like you to see, just feel the fascia. One way it's going to be harder to move than the other. My leg wants to move out rather than in. So I'm just going to wring it. And I'm going to wring the fascia. A lot of great stretches for the quads. I will review stretches minimally. This is about actually creating change in the fascia through touch, through manual manipulation. Grab your quad and squeeze it. You can even skin roll. And skin roll is pretty intense, but you can skin roll. And for those of you who have some knee pain, skin roll across the knee. I had a gal who fell on her treadmill and fell right on her knee. And no matter what we did to every single attachment to the patella, we could not get the pain to go away, but this rolling created enough break in the scar tissue, warmth in the fascia. It's pretty intense right here, right there. You can skin roll, move the fascia, move it around. You can also stretch the fascia. This is the Massage Star. It's a great tool. Not too expensive, I don't know, $20, $25. But you can hold the tissue and just gently stretch. This is not too deep. You'll find that when you come around to the inside of the leg, it can get pretty intense in here, the inside of the knee, the inner thighs. So tune in and see what you feel when you do this work. You'll also want to grab any of your tools. So let's say the stone. You can grab the stone and just run across the iliotibial band attachment down here on the lateral portion of the knee. It's effective. It's pretty cool. See, I feel it right in here. And it's stingy. So I'm going to release a little bit. Take the breath and then roll through the fascia all the way through the leg. You put a little lotion on. I would prefer you to use organic coconut oil, something without chemicals. Whatever works for you now. Find your tools and make a change in the quad. If it's too tight, you will feel the quad will be tight. Your runners, marathon runners, you're going to need to give a little bit of your attention to this area. And here, you're just going to take one of my T-bars that you'll find on the site, and you're going to go right into this area. Now you can do this lying down. It's going to be right along the femur and right in this joint. Let me lie down and show you this, because this is a super great way to, so big breaths. And see, I'm just moving the fascia. Don't go inside the hip bone. There's no reason for you to go inside here. None at all. Stay out here. Yeah, that's important. All right. And then move all around the attachments in the hip. Yeah. And you can even come down into the vastus lateralis and its connection to the IT band. And you can certainly, gently, mindfully, knowingly, and carefully work around the knee. And it's not a lot of pressure. It's just very light movement and creating just a little space all around the knee, and the attachments in the femoral head and the tibial head around the knee. Some of them are going to be stingy. Take a breath, then go. Therapeutic breath, and then find it, and then perhaps hold it. See if you feel any referrals down the leg or up into the hip. Hold it. Maybe shake it a little bit more. And then find another spot. See, that's always very sore on me. Right in here. And probably also right in this injury for me. Yeah. The last piece for the quad is the balls. Start off with a softball. Always be wise. Never overdo it. I don't want you to create pain when you're trying to reduce, when you're trying to create space. We don't need you to create more inflammation. So this is important for you to choose a softball, and then you can go into the hard balls, the lacrosse balls, and they're intense. And tennis balls are actually pretty intense too. So I'm going to start with the rack ball, and I work my way up. And then I just go into the quad. And again, we're kind of just bracing and working all the way through. Doing up and down movements along the fiber, and then face down for the quad. And the ball is underneath my quad, and I'm just rolling back and forth, finding a spot, relaxing the body down. Do you see how I just let my body roll and then settle in, waiting then 8 to 12 seconds, coming out of it, and then taking a breath. Any of these will work on the quads. You can use the dryer ball, the attachment just above the knee, and move that all around. Go into the attachments around the center, and then immediately. So try and see how these work for you. you are able to make a change. Oh, see, that's nice and warm and toasty. I teach a foam roller class and we do all of these in there, and the quads are hard-working muscles. Everybody works their quads, and everybody's quads needs to be released and given attention. So thank you very much for tuning in. Next one's going to be glutes, so stay tuned to come see my website, treatyourselfnaturally.com. Jenny Sprung.